My name is Alyssa Peachy. I'm a graduate student of Health Administration at Penn State Harrisburg, and today we are going to explore options for transforming the electronic medical record, or EMR as we know it, in order to improve patient and provider interactions. In this presentation, I will show you some current problems and best practices within the EMR and how the future might look very different for clinicians. It is no surprise to any healthcare worker that 87% of primary physicians use EMR. But for the most part, EMR is not set up for efficient workflows. Many physicians report that the EMR is cluttered and creates additional steps that ultimately take away from the care they provide to their patients. One physician said, "There is nothing more frustrating to a patient than talking to their doctor, wanting advice, and that provider is typing away and looking at a computer screen instead of the patient." But with that being said, studies also show that EMR leads to burnout among clinicians. In general, we know that providers spend more time in the patient's electronic chart than having a face-to-face conversation. It's also known that patients are happier when they have direct input in their care as well. However, many doctors are frustrated with how time-consuming EMR has become and how they can impede the doctor-patient relationship during exams. EMR distracts from the patient instead of including them. Difficult use of EMR leads to provider burnout, which ultimately impacts the care of the community. A time-motion study published about 2 months ago in the Family Medicine Journal concluded that primary care physicians spent more time working in the EMR than they spent in face-to-face time with patients during clinic visits. On average, family doctors spend about 54% of the clinic visit using EMR. While the reviews of EMR are mixed, many agree that EMR has slightly improved the quality of care, while others feel the EMR interferes with office workflow and decreases productivity. To overcome this problem, EMR interfaces must be easier to maneuver, reduce the amount of clicking, and be successfully integrated into the patient's visit. Until some changes occur in the EMR interfaces, some of the best practices to improve the patient and provider interaction are as follows. Engage the patient in their chart, let them see what you can see, explain what you are doing while clicking or typing, and print important documents so that the patient can follow along. Lastly, arrange the clinic rooms so that both the provider and the patient can see the computer. There is room for improvement within EMR that all hospital staff should be excited about. A better EMR would provide even more value to the patient. It would sync records to their phone, it would make predictions of the future, and this would be done instantaneously. The new EMR will engage the patient and provider at the same time, requiring patients to press buttons and make their own selections within their EMR. And it would capture this all in real time, document, and possibly consent in the background using artificial intelligence. A known healthcare consultant, Sam King, said, "Physicians that know AI will replace those that don't know AI." And this is similar to the physicians that didn't want EMR, simply retired, or were replaced by physicians that were learning EMR. A better EMR will have dual views. The patient view, what the patient and the provider will see when they are in the room, and the provider view, what the provider looks at before going to see the patient to quickly capture the patient's record in a list or bullet form. The patient view will have predictive modeling to show the patient where they are headed in 5 or 10 years with and without medications and lifestyle changes to be able to predict stats for the patient and the provider. A better EMR will present this information in a way that all patients can understand, such as touchscreen, videos, and visualized data that is color-coded. In this interactive model, artificial intelligence, such as a sophisticated medical Alexa, would be able to predict a patient's future medical history. Here, a patient has high cholesterol. An artificial medical assistant would be able to predict a patient's cholesterol in about 5 years without any lifestyle or medication changes. The artificial system would also be able to predict and show the patient in real time their cholesterol levels in 5 years with changes to their diet, and even predict changes in medication. This information would then sync to the patient's portal to be viewed at home, requiring fewer visits to the clinic and providing better quality and more satisfying care. A real example is Mayo Clinic has enabled patients to use this first aid skill at home through Alexa to be able to effectively manage their healthcare from home. So healthcare is moving towards artificial intelligence. Learning ways to integrate EMR into the patient's visit is important because it will decrease the time the patient spends away from the patient in EMR and include the patient in their own care. A more visualized way to present data will make workflow easier for clinicians and reduce burnout. Providing statistical predictions for care will improve the quality of care and instill trust between the provider and the patient. I thank you for listening and watching, and I hope you're excited for the future of EMR.